the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here on a Thursday. And hopefully this morning we can help a few of you in terms of what healthcare is out there, all right? We do this every year right about this time, and whether or not you realize it or not, starting on November 1st and running through December 15th is open enrollment for the Affordable Care Act, all right? So many of you have your health insurance through this program, and there are a variety of different plans out there. Open enrollment comes about when you get a chance to kind of evaluate how have things gone for you the past year. Has your condition changed? Do you need perhaps some different types of services? On the other hand, maybe you're happy with what you have, but hey, let's check and see some of these other plans. Might they be better suited to me in some way, or maybe be more affordable for what I need? All of that is what happens. Of course, doing that and getting it done and some of the bureaucracy involved can be tricky. That's why we do this program. And there are people out there to help you, and one of them is joining us this morning. Mary Moore, good morning to you.
It's good to see you.
Good to see you again. She's with Get Covered Tennessee, and this organization, I guess, among other things, is in place to help folks navigate the marketplace.
Exactly. So we received some federal funding through the Navigator Grant.
Okay.
So we have hired and trained navigators who are federally certified and also registered with the state to go out into the community and help people sign up for health insurance.
It's real important. I want to emphasize here that you're not here, or these folks are not advocating and trying to push any individual, and there's no money made for where you push it. Your sole purpose is to have people who contact you, and we'll tell you how you do that, you know, to share their information with you, and then you just help them find what's best for them. Okay?
Exactly.
I mean, it's not like you're, oh, well, pushing this because I get a kickback if I sell this insurance or what. No, that's not the way it works.
Exactly. So there's no commission involved. There's no pressure. It doesn't make a difference to a navigator. I mean, we would love to see everybody get into a good, affordable plan that's going to work for them.
Right.
But at the end of the day, if they don't feel they have that option on the marketplace, there's no pressure whatsoever.
Obviously, the marketplace is, you know, nationwide and various states. Do all the states have navigators? Can you imagine other programs like this? I know there's different plans offered in different states, but do they all have navigators to help folks, do you think?
All of the states that use the federally facilitated marketplace, which is found at healthcare.gov, do have a navigator program. So it's actually written into the Affordable Care Act that there is a navigator program.
Meaning they, when they put it together, thought folks might need a little help with this.
Yeah, it's a totally new program.
Costs nothing. Keep in mind, though, I mean, it was surprising to me. Time flies. It's been 7 years.
Yeah,
7 years.
The 7th open enrollment period.
Of the open enrollment. And again, if you would, for folks, and we'll open up the lines if people have questions. If not, I'm just going to walk through some of the changes. But why is open enrollment important? I mean, if you are on a plan right now through the marketplace from last year and you're happy with it, do you still have to go in and re-enroll?
You do not. So this year we don't have any plans that are being discontinued from last year.
So it's not like, I understand if you had one you liked and it stopped, you'd have to find a new one. But that's not the case, right?
That's not the case. There is auto re-enrollment. If you just don't do anything, you can auto re-enroll. We do encourage people to go back and look at the marketplace, because even though the plan that you have now will still be there, the price may change because we have some new plans that are coming into the marketplace. We have a little more choice this year, and it's very complicated, but the price of the plans has to do with how many plans are offered, which plan is considered the lowest cost silver plan. That's kind of the benchmark plan, and that sets the financial assistance for all the other plans.
Right.
So if the plan you have this year is not the benchmark plan, what you pay may change, and you may be able to find a better deal with another plan. It's definitely worth taking a look at, especially if anything in your situation has changed, as you mentioned. So if your income has fluctuated at all, if you've had any household changes, it's a really good time to go back and look and make sure that you're in the best plan.
All right, and let's remind folks what this marketplace is and what the Affordable Health Act is, or Care Act is for. All right, I work at News Channel 5, and through the Scripps Company, I'm able to get insurance, and I have to take it here because I have it available to me, and if I choose to have insurance, and I get it through my place of business, all right? So that's where a lot of people get insurance. Some people maybe just buy their insurance on their own through an insurance company if they have the means. Who are the people that are in the marketplace?
There's about 5% of Americans participate in the health insurance marketplace.
Okay, and they would be, why would they participate? These are folks maybe that are self-employed and don't have a means to get insurance through a place of business, right?
Yes,
is that basically it?
That's probably that's the biggest target population, are folks who don't have access to affordable employer coverage. They can go onto the marketplace. So a lot of self-employed people, if you work for a small business, that's not required to offer insurance. Some people work part-time, so they're not eligible for the health insurance through their work. A lot of people may work 2 part-time jobs, so even though they're working full-time hours, they don't qualify for insurance at either job. So that's the population really that we're helping.
For instance, though, I'm not allowed to go onto the marketplace, am I? Because I have this. Let's say I went on the marketplace and I actually found a plan that's better than what I'm getting here at work. Could I do that?
You could. You would not be eligible for any financial assistance. So what really helps people out on the marketplace is when they're eligible for subsidies through the premium tax credit.
And you qualify for that based on your income?
Your income, your household size, and then other factors like, are you offered affordable employer coverage?
Are there many that have affordable employer coverage that are on the marketplace, or is that very rare? Are there circumstances where that can come into play?
It has before. I would say for most people, if they're offered employer coverage, it is more affordable than getting unsubsidized coverage on the marketplace, because unsubsidized coverage on the marketplace is really, it's just the individual market. So it's just paying full price for the health insurance. And normally if you're getting it through your employer is subsidizing.
Exactly. Okay, great point. About how many Tennesseans would you say are in this? I mean, that may be watching us now.
There's about 180,000
180,000 folks. Okay, so if you're in a plan that hasn't been dropped and you're happy with it, I guess you leave it there. But I guess when you've been on before, you've recommended, hey, even if you're happy, doesn't mean by looking into it you have to change. But what do you recommend to most individuals?
I definitely recommend going back into your marketplace application, calling someone for help, and looking through the plan options.
Okay, because even if you're happy with it, it's possible you're saying there's one that maybe is very similar that's less expensive, or maybe is just a little more finely tuned to what you need?
Yeah, so for example, there could be a new plan that's available that covers more doctors that you want to see, or covers a hospital nearer to you. If you've had any issues in the past with finding doctors that take your plan, because all of the health plans on the marketplace in Tennessee are what are called EPOs, or exclusive provider organizations. So they all cover in-network care only. So it's really
and that's different than an HMO?
Yes. This is an EPO, it's exclusive provider organization. You have to go in-network. There's no in-network coverage. So you're tied closely to that network. So if you've had any experiences in the past with getting a marketplace plan and your doctor not taking it, or having difficulty finding a doctor who takes it, it might be worth looking at some other options to see if there's a network that works better with your area and where you want to go.
All right, and you know what, I was trying to get a handle on this last year, and I think I was getting it. Yeah, okay, you talked about the silver plan. So how many, there's silver, and then there's gold?
There's bronze, silver, and gold.
Bronze, silver, and gold. And so and I guess gold would provide the highest level of coverage but be the most expensive?
It does, and most of the carriers only offer maybe one gold plan. It's not very well utilized. Most people don't find that gold is a very good value.
Because you're just getting more stuff that you're not using?
Well, a lot of folks qualify for, so there's 2 types of financial assistance on the marketplace. There's the tax subsidies that lower the monthly cost, and then there's also cost sharing reduction, which lowers your deductible and out of pocket. And a lot of people qualify for that cost sharing reduction, and it's applied to the silver plans. And essentially what it does is it takes a silver plan and kind of beefs it up to make it almost like a gold plan, but you're paying the silver price.
And the plans basically, well, I want to get into kind of what the plans offer, and just for what people can understand if you've had insurance in the past and how it fits and all of that. Also, we'll talk about how the fact that as opposed to last year when the number of plans went down, it's more than doubled this year, and there's more choice out there. So we'll take a break. 737-7587. I know many of our viewers sometimes in the morning, a little older, many of them may be on Medicare. Okay, and so this may not necessarily apply to them, But as you heard her say, more than 100,000 people in Tennessee deal with this, and at some point you may. Heck, I may if I get fired tomorrow, right? And I may have to find insurance. So if you have any questions or comments, 737-7587, we can take those if you want to call in and join in the conversation there. If not, certainly I've got plenty of questions for her. So we'll be right back after this.